Hello everybody, welcome to this Climate Now live here from COP28 in Dubai. My name's Jeremy Wilkes. I make a monthly program about climate change for Euronews, which you can watch by heading over to euronews.com/climate now. And we are here to talk about heat and health and how climate change is impacting our health. We had the first ever health day here at Dubai yesterday. It has become a major topic that everybody's concerned about, and our panelists are going to be here to help us dig into some of the detail about what's happening, why it's happening, how we can adapt as well. Thanks very much for being with us. Maria Guevara, who is the International Medical Secretary at Médecins Sans Frontières, Dr. Marina Romanello, Executive Director at the Lancet Countdown, and Dr. Carlo Buontempo, Director of Copernicus Climate Change Service. Thank you for being with us. You're actually a doctor as well. I'm sorry, I should have said doctor.
No worries.
How are you? Everybody's talking at the moment about the atmosphere here at Dubai, and I'm not talking about the way people are talking and the information, but literally the air, the particulate matter here is very high. Are you feeling it already? It's hot, it's polluted. Are you kind of feeling that thing that everybody's talking about? Go on, Marina.
Yeah, I mean, absolutely. It's boiling outside, and it has. For anyone that is here, the big challenge I think has been that everything is so far away. You have to walk everywhere outside in the sun, and it has made it very challenging to get to meeting rooms, to get places. It's incredibly hot. It's breathing. You do feel that there's something that is not quite okay, and there's a lot of dust. Pollution as well from the desert.
Yeah, it's my first time in Dubai, but I feel kind of looking out across the horizon that there's a lot of matter there. Are you feeling that also?
Yeah, no, and I actually am regretting that I didn't bring my inhalers, because normally I have exercise-induced asthma. I'm a lung doctor by training, and I should have brought that with me. I just did not actually expect that it would be kind of this hot.
Yeah.
With a significant dust, but
that's like a simple adaptation measure that you should have been taking, right? Carlo, what's been your experience?
Well, for me, coming from Europe at the moment, Europe is in snow. We got this snowstorm in Munich and Scotland, and all north of Europe is experiencing really unusually cold weather. And you arrive here, and especially on the first few days, we had to queue quite a bit.
Yeah, acclimatizing has been quite a shock, hasn't it?
Yeah, it was quite a shock. And as Marina was saying before, these long walks in the sun.
Yeah.
I don't think you fully realize what is the impact of heat when you are outside.
No, and I was reading today, in fact, that the P2.5 particulate matter can actually go inside your blood, right? It goes into your body. Can you tell me a bit about that?
That's right. PM 2.5 is basically particulate matter air pollution of 2.5 micrometers, so 1 millionth of a meter of diameter. That is very, very small. And what that means is that as you breathe it in, it goes deep down into your lungs and it can pass onto your bloodstream.
Does it stay inside you?
It does, and that's why we think that it's affecting not only our respiratory system, but also many other of our body systems, or of our essential life support systems.
And it's coming from burning fossil fuels, right?
It is coming from many sources.
Right.
So air pollution comes from desert dust that is being made worse because of climate change, because of aridity and drought. It comes from burning biomass.
Right.
It comes from forest fires, and it comes from burning fossil fuels. And from burning fossil fuels, we have data that estimates that we have about 1.2 million deaths every year from outdoor air pollution derived from fossil fuels alone. And there's a recent study that says that it could be as much as 5 million deaths every year from PM 2.5 from outdoor air pollution.
So it isn't something to take lightly. It's something we should already be thinking about adapting to. Maria, I'm wondering, is in your personal life as well, when it comes to climate change and health, have you taken any particular adaptation measures in terms of how you do things, maybe when you exercise, or what some of your habits have changed?
yeah, I mean, I do a lot more indoors exercise because of that possibility of exposure to air pollution, the heat, because there's a huge risk for heat stress when you're over-exercising outside. So unfortunately, you're not able to enjoy the real natural system, the natural ecosystem, and the beautiful nature that is outside, unfortunately.
Yeah.
But where I live in Geneva, I'm quite fortunate, but in many of the places that we work at MSF, even in the big metropolitan cities of Delhi, I had visited a few years back our teams in Delhi, and the air pollution was incredibly massive in the middle of a heat wave, and that was impossible to work in. So it's something that we need to look at, not just for our patients, but also our staff. It's now reflecting on how do we actually care for our staff also to make sure they're able to deliver care. So
I think this is the message is really is that this heat and health, climate change and health interface is everybody's problem. Actually, it's not. If you live in a rich and wealthy city, you're also as much affected as anybody else would be. Carlo, are you changing anything in your life because of how the weather is changing?
Yeah, well, starting from my house, I just refurbished my house and I decided to go for a really thick insulation, but no air conditioning. So the idea of having a house where I can live in summer without consuming extra electricity was part
keeping it cool, basically.
Keeping it cool, exactly. Yeah. Because, I mean, I grew up in the Mediterranean. We are used to hot summers, but if you look in recent years, has been just unpleasantly hot, so much so that you really don't want to go out at lunchtime.
That's it. That's the same for me. Keen cyclist, but when it's way over 35 degrees or so, I'm not going to go out for a bike ride. And, it's literally stopping me from doing things. And we're going to talk about this later on, actually, the things you should be doing in order to stay healthy, which is doing sport and exercise. But let's just go back to sort of where we are in terms of heat and health. Marina, you published the Lancet Countdown report recently, which is pretty surprising reading on the situation related to climate change and health. Can you give us a quick summary of sort of where we are? What are the key findings?
Yeah, well, so the Lancet Countdown report is the 8th report that we've produced. And we started just after the Paris Agreement with the motto of monitoring progress on health and climate change. And what we have found is that we've monitored lack of action. And we're seeing that across every single one of the indicators on which we're monitoring the health impacts of climate change, things are getting worse very rapidly. We're seeing, to give you just a couple of figures, heat-related mortality, talking about heat and how dangerous it can be, of adults over 65 years of age, a very vulnerable age group, has increased by 85% since the 1990s alone.
Right.
And that is more than twice the increase we would have expected at constant temperature. So we know that this is driven by the rising temperatures due to climate change. And we're seeing 127 million more people that are now food insecure, that cannot access the basic food that they need to meet their nutritional demands because of the increased incidence of heat waves and droughts. We're seeing expansion of infectious diseases, everything. And the most concerning thing is that we are monitoring these things in isolation. But we operate in a complex system. So all of these different hazards we're being exposed to in parallel, adding enormous pressure to our health systems and having these kind of multi-hit scenarios, multi-dimensional impacts on our health, undermining the physical, the environmental, the socioeconomic conditions that our health and well-being depend on. So it's by far the biggest threat that we're facing today due to climate change.
Maria, we associate Médecins Sans Frontières with dealing with emergencies, heroic moments when there are disasters and things. But how is climate change now coming into your work there at MSF as well?
So we've had a great opportunity to work with Marina's team and the Lancet Countdown. We've published also our own policy brief around that. But in our internal reflections and looking at our numbers just in 2022, it has actually, our volume of projects that we're working in 85 countries have gone from 800 projects before COVID to at least over 930. And a lot of that was actually emergency response. We've been in some contexts that are much more stable, but we were unable to do any kind of routine work, whether it's routine vaccine programs, because we knew at the wake of COVID that would be a problem that would be additional to outbreaks. But with climate change, on top of conflict, on top of post-COVID, we've had to deal with infectious disease outbreaks everywhere. Cholera has broke out in at least over 30 countries. In areas that were on the road for elimination are now back. Haiti, for example,
and you're attributing that to climate change effects?
Well, it's a combination of all those. It's a triple whammy, if you can say. It's a triple threat of the global warming. We know that from the Lancet Countdown that the warming waters makes it very keen for Vibrio cholera to balloon. And we're seeing that in real time. We're seeing dengue outbreaks. We're working in Honduras. In the last 10 plus years, we've been addressing 7 outbreaks. So we're trying to innovate in how to try to mitigate that, adapt our programs to ensure we try to decrease the numbers of 10,000 cases a year. We're seeing malnutrition for the 127 million that Marina mentioned. We're actually seeing doubling and tripling of severe acute malnutrition cases, especially in the Sahel region, for example. And these are big, big numbers, right?
Yeah.
Our outpatient consultation has gone from 12 million in 1 year to 16 million, just seeing them in an outpatient basis. That's a lot. And we need more data to understand, especially in the humanitarian hotspots, to understand just how much of these compounding factors are working together and how much of that climate is really driving on top of that.
Interesting. Well, that brings us to Carlo then. How is your community of climate scientists interacting now with the healthcare community? What kind of information are you exchanging with them? What kind of meetings are you having? What kind of projects have you got?
Yeah, well, I guess the fundamental element in what Maria was saying is that the climate is now changing at such a rate that we cannot assume that the risk of the past is a good proxy for the risk we are going to face. And this imposes a new way of interacting. And, we have a lot of data, good quality data about the climate of the past, the present and the future. But this data needs to be bridged, needs to be contextualized. And one of the initiatives in this direction, for instance, is the thematic hub on health and the interface with the Health Observatory in Europe, where the information coming from different services. We are talking about the PM 2.5. Well, we have actually forecast of PM 2.5 globally, and this information needs to be crossed with other information, maybe on temperature and how the two interact, or water availability, or wind in terms of spread of diseases, for instance. And the idea is to have a single place where all this information can be accessed, and that's the thematic hub on health. And also a place where...
So that's that's a website then,
yes,
is it?
That's right.
What's the website?
Health.copernicus or healthhub.copernicus.eu, I believe.
Okay.
But if you look for health and hub and Copernicus, you'll find it.
All right, okay. And that's bringing together that information, which was out there, but it wasn't actually in the same place then before.
Well, it's not just an entry point for data. I think one of the things that often is lacking is a set of examples on how this information can be put together. So the Lancet Countdown is a very good example on how all these sorts of information are put together. But having example on the ground of a guy who takes this information coming from here, mix it up with other information, include socioeconomic or epidemiological information, and generate something that wasn't existing before.
Right.
And having a traceable story on how that was successful actually makes all the difference. And the obvious example for me are early warning for heat waves. We are not blind in front of this heat wave. The heat waves, if you see what IPCC is telling us, the IPCC is telling us that heat waves are becoming more intense, more frequent everywhere. And so
I hear these calls for these early warning systems, but are they working now? Are there already early warning systems for heat waves?
Well, there are, certainly. At the regional level, there are several regions where the information, not only the connection between the climate or weather information and the authority works, but then there is a plan in place when certain conditions are reached to trigger action on the ground in terms of safeguarding the vulnerable community, in terms of advising.
But are they working? Maybe, Marina?
So early warning systems are frequently found, and we have them in many countries, not in all, but in many countries. The thing that is a bit more challenging is the early response system that comes after it. So what do you do once you have that early warning system?
Right.
And countries are increasingly implementing strategies to take care of the vulnerable populations, but we still have a lot to learn about how to best do that. What are the interventions that best work? For example, in case of a heat wave, how do you reach the very vulnerable communities, those that generally are or socially isolated, or the underserved communities, the marginalized?
Yeah, I mean, how does it kind of manifest itself? As a sort of like a text on your phone or something that says, watch out, heat wave coming? Yeah.
In the UK, there was a very interesting example by UK HSA in 2022, where in the heat waves they had the first red alert in an extreme heat event, and that had to do with direct communication. And it was very, very efficient. They saw that heat-related mortality was reduced with respect to modeled expectations. But then there's a lot to be learned also.
So there was a sort of measurable positive impact from it happening.
We are being able to understand that they do work, but how to optimize them and how to ensure that they keep on working, that we have behavioral change that is long-lasting, that people can learn how to cope with extreme heat, and that we adapt our cities to extreme heat. In the UK, it's not a particularly hot country, let's be honest.
I know, their
But
houses are very badly adapted to heat.
Yeah, the weather is not particularly warm. But it's very vulnerable because people are not well adapted. They are not used to behaving around a heat wave. Our buildings are not well insulated. So that means that heat can be actually very lethal in a country like the UK.
Even a rich country like the UK. Maria, in poorer developing countries, are these kinds of early warning systems working? Are they actually doing better maybe in those countries, or how's it working?
Well, what the early warning systems are dependent on are data, and as accurate as they need to be, and then putting over data of climate and others to predict better, right? So that we want to use it as a kind of a predictability. And one of the things that we've been trying or piloting is actually the malaria anticipation project in South Sudan, where we're actually putting data that's epidemiological from our clinics with that of meteorological and climate data, which we were already monitoring because we knew that was lacking in the areas that we were working in. So putting those two is actually creating predictability of when you might have a huge malaria outbreak within 2 weeks, within a month, and the accuracy changes depending on how much of that data you're able to capture and putting on top.
That's really interesting.
That also helps us target where we need to be more focused regarding our project, so you become much, much more efficient. But also on that is, that heat is one thing, but then it's compounded and it's usually followed by a big storm or flooding and droughts. And that, by having those data put on top of each other, we're able to also predict and prepare the community to have canoes on standby in case they have to go. That's the only way they can go to the clinic, especially for the pregnant women and the elderly who cannot navigate otherwise. So these things is an emergency preparedness response, something that we do, but doing it in a smarter way, in a much more climate smart way, in a more predictable way, because you're dealing with the unpredictable. So you're going to try to find a way to make it as predictable as possible.
A lot of people ask me actually about heat particularly. They ask, well, can you give me a number on what's too hot? Like, where does too hot to be healthy start? And where does just a bit, well, maybe you should go and stand in the shade sort of end? Marina, is there a sort of a way of giving a number on that, or is it actually every person has their own feeling?
Well, we were just discussing that precise point. It's quite complex because it does not only depend on temperature, but it also depends on humidity. But the important thing to take into account is that we are not all equally vulnerable to extreme heat exposure. So if you're, for example, a person above 65 years of age, elderly populations, very young children under 1 year of age, people living with respiratory disease, cardiovascular disease, with kidney issues.
Right.
They are very vulnerable to extreme heat exposure. So by and large, what we see in heat waves is that it's those populations that make the bulk of the heat-related deaths that we see.
Can you explain, without going into sort of too much difficult medical detail, but actually why those people are more vulnerable? What is it that's going on inside the body then that triggers a problem?
Well, when we're exposed to extreme heat, our bodies work at a very small range of temperatures. So we have to keep our body temperatures within a very narrow range for us to be healthy. And what happens when you're exposed to extreme heat is that your body is desperately trying to cool you down, to keep you within that range. That changes your blood flow, sends blood to the outside of your body, to your surface, for you to cool down. You start sweating. That reduces the liquid that you have effectively in your blood because you're sweating and you get dehydrated. And there's limits to how much that can work. You start seeing stress in our cardiovascular system because of that dehydration, because of the pumping of blood to our out to the outside of our bodies, and then to the surface of our skin. And then you start seeing also that as you start struggling, you start sweating too much, you cannot control your temperature starts going up. That leads to heat stress and could eventually lead to heat stroke. That is a medical emergency. It is lethal. And once the temperatures have gone up a certain limit, it's very hard to bring a person back down. So that's why those communities that have already some sort of impairment, some sort of underlying health condition are particularly vulnerable, because all those systems of protection
Because
will
their
not be able
system's
to work
already
so
stressed
much.
or not performing particularly well. So I saw you, Maria, nodding a lot there. Would you want to add a bit more?
No, but I mean, I think the point is that the individual's health status, baseline health status, has a huge impact on this. And already we know the elderly, the pregnant women, the infants and neonates have the highest risk because their thermoregulatory capacity is challenged. Most of the elderly will probably be on, have other comorbidities, as mentioned, who may be taking drugs that make it even worse for them to accommodate. So they will be the ones that need to know exactly what they need to do when the heat is high.
And again, this is basically, as I was saying at the beginning, this concerns everybody,
Yes.
right? Everybody is concerned by this. It isn't people in poorer countries or people who are, I don't know, maybe less socially advantaged or whatever. Everybody's concerned by this.
It's very true. And I think, but for where we work, a lot of them don't necessarily have access to the healthcare to try to mitigate and try to answer to if they were in heat stroke or even just some dehydration.
Yeah.
That's not always there. And so this is where we need to make sure that the resilience aspects and adaptation aspects are really in place.
We're here at COP28 and everybody talks about 1.5 degrees of warming. Well, you hear about that from the politicians anyway, and you also hear about 2 degrees of warming. And I'm wondering, Carlo, is there really a kind of way we can interpret a significant difference between those two numbers when it comes to heat and health, actually? Are we going to be suffering much more in a 2 degrees warmer world than a 1.5 degrees warmer world, which is sort of almost where we are now?
Yeah. Well, first of all, I think it may be worth having a look back at this year, because this year has been incredible in many respects, climate-wise. So we got in July the warmest day on record, and both in June and then in July, we passed at the daily level the 1.5 mark. And the rest of the year, we got the warmest July, the warmest September, the warmest October, and now, in all likelihood, the warmest November, the final data.
We should find out from you next later on this week, right?
Yes,
the
on
Copernicus
Wednesday
Climate Change Service will be
release.
publishing their data, and you'll let us know. In fact, you don't know yet, possibly, whether or not
I do.
it was. Okay, you do, but you're not allowed to tell us.
I think I can tell you it's going to be the warmest on record as of November.
That's an exclusive, everybody.
Well, it's not really a surprise, though, in the sense has been so warm throughout, and that's part of the story. So a couple of weeks ago, we reached the 2 degrees at the daily level. So that's not the 2 degrees of the
And
Paris
that's on
Agreement.
a global level.
On the global level. And in a sense, if there is a metric that you see throughout the IPCC report, is the fact that the impact grow with the temperature grow. And so we know that it's not.
But they don't just grow in a linear way.
No, it depends on the impact. Certain impacts grow linearly, certain others, and health could be a good example of that, and in particular heat waves, they don't. They are growing much faster than linearly, and I think you can probably, the other panelists can argument better that element. But what is extraordinary is really the speed at which this is happening this year, and in a sense, if we think about what might happen next, that's quite scary, because as you were saying, there is a very narrow range of temperature where we are okay, and the direction of travel of the climate system is in the direction that doesn't, that really push on the boundary of that range. So there is a novel I read recently about science fiction, climate science fiction, and that novel starts with a heat wave killing 1 million people in India. And what I found scary of that book is the fact that that's not unrealistic. It's a scenario that is entirely plausible. It's something we might see within the next 10 years. And that's the level of risk we are facing.
You're genuinely concerned about the kinds of heat waves that kill hundreds of thousands or millions?
Yeah, well, I mean, we have seen it in Europe already. Depending on the estimate you consider, in 2022, we have seen a heat wave that may well have killed something in the order of 100,000. I mean, the estimates are lower, but we are talking about several tens of thousands in Europe. That's incredible.
Can I bring you in on that?
Yeah, for sure. Look, we have done some estimates of projections, and we're projecting what would a 2 degree world look like. And 2 degrees of heating is the upper threshold that we've committed to in the Paris Agreement. And even that would take us to a 370% increase in heat-related mortality by mid-century. By mid-century, in the next 30 years, 370% with respect to today. That means that each unit of carbon dioxide that we emit, each fraction of a degree of temperature rise, makes the prospects worse. And it's really a life or death matter for many people.
What does that world look like, a 370% increase?
Look, that's the tip of the iceberg, right? Because when you talk about 370% increase in deaths, there's underneath that a huge iceberg of burden of disease,
right.
of hospital admissions, of healthcare professionals that are struggling to care for their patients, and of often very severe and irreversible kidney disease, and the burden of disease is quite substantial. So we're not yet being able to measure what that looks like. But what is, without any doubt, is that that's a very dangerous future that we need to avoid by all means.
But it's probably going to happen as well, according to what I read. I was talking to Yuri Rugli from the IPCC this morning in the queue, which is very nice to run into people like that. But also, you know, a bit of a wake-up call early in the morning to have a chat with somebody like that. Maria, I'm wondering whether you feel the fact that they had a health day here yesterday, was that a good thing, or did we see a little bit of health washing, which is a new word I've just learnt? It's kind of greenwashing, but with health in it. Is the fact there was a focus on health here at COP28 very helpful, or was there a little bit of distraction from the actual business of phasing out fossil fuels?
Look, I know many people have been fighting to get health on the table. MSF has joined since the last 5-6 years. Personally, I was attending the COP on the health on the sideline of COP in 2018. And that was a side summit, not even in the center of COP. In COP26 in Glasgow, we were in the blue zone. That's amazing.
Yep.
And now we're in center stage. We had our international president speak to it. That's, to me, a historic moment.
Right.
And what needs to happen after that is that it needs to stay in the center stage, needs to go into negotiations. It needs to be translated into action with commitments that goes, and you were just speaking about the IPCC, the 6th report. It also means it needs to go to the most vulnerable today, because we can't imagine a 370% increase, but actually I just met Johan Rockström, and he was speaking around the 6 boundaries of the planet, of the 9
That can be a
planets
sobering experience,
already.
having a chat with him.
But the just boundary that they've defined is actually 1 degree. And we're way past that.
Yep.
And the people who are getting hit today are where we're working, and we just need to look there and see what it's going to look like. And I think this is why it needs to get on the field.
But when you talk about action, and there's a lot of talk of action here, time to take action, what exactly do you need, actually? What would you know, is there a sort of a top 3 things you go along and say, we need this now, please?
Healthy should be the new normal. We need to use health as the rudder that we navigate towards, and that needs to be in all our documents and negotiations. The communities most affected needs to get the finance and support that they need to get, and the ultimate cure is obviously phase out of fossil fuel.
Yeah. But were that to happen, would it actually have an impact on health quickly, actually? What do you think, Marina? Would there actually be a health impact straight away were we to stop burning fossil fuels?
Fossil fuel phase out, we always say it is the most important public health intervention of our times. It definitely is. It will not only avoid the enormous damages that we were talking about, but what's interesting is that also it can deliver immediate health co-benefits. If you deliver it by keeping people's health and people's well-being at the center as a priority of what you're doing. Obviously, you're not just going to turn off all of the energy all around the world from one day to the next. That would be catastrophic. But we need to go in a very steep slope towards increasing our renewable energy, increasing our access to renewable energy, reducing energy poverty, particularly in those communities that still don't have access to energy, and quality healthcare that comes with it. And the interesting thing about air pollution is that most of it, or a big part of it, not most of it, but a big part of it comes from the burning of fossil fuels. So by phasing out fossil fuels, we could save, from our estimates suggest, 1.2 million deaths from air pollution, outdoor air pollution alone, to a recent estimate that said that it could be up to 5 million deaths that we could save if we were to eliminate our fossil fuel burning. And that's every year, 5
Why isn't
million
that,
deaths
why isn't that
a
argument
year.
getting through then? Because it sounds very convincing, doesn't it?
Look, it kind of is getting through,
Right?
but we still need robust political commitments. We need robust political action
Like
and
legally
courage
binding.
and legally binding commitments to phase out fossil fuels for our sake. We cannot be sitting here at the 28th annual negotiation, 28 years of trying to tackle climate change without addressing the first source of the mess we're in.
Yep.
And of the health crisis that is our persistent burning of fossil fuels, particularly when we have now developed renewable energy technologies at a pace that was unthinkable 10 years ago. They're now cheaper than fossil fuel-based energies. They could provide energy to those countries that need it the most. And we're still perpetuating the harmful addiction to toxic fossil fuels. So that is unforgivable.
Carlo, what are your thoughts on this?
Well, my thoughts from a climate science point of view is that actually this is not new, right?
No.
We know about the connection between greenhouse gases and climate change since the end of the 19th century.
Well, I thought the UN Environment Programme, the name for their report this year, A Broken Record, as in you keep hearing it again and then again and again, and the play on words on records being broken was rather neat, because it does feel like that.
Well, I think it is double in a sense, because the broken record is repeating something, and the fact that we keep breaking record, because having not reached net zero, having at the moment being quite far from it.
Greenhouse gas emissions keep going up. Concentrations of CO2 in the atmosphere keep rising.
Yeah, there was a speaker yesterday at the science event I was at actually it was at the Earth Info Day in the plenary, who put their hand up saying, well, I understand all you're saying, and this year the concentration of CO2 have gone up by 2 parts per million, and that's keep increasing. And until we stop that dripping, we cannot expect a different outcome in terms of temperature or in terms of impact. We know that that's the driving mechanism, and so that's the way to, going back to what was being said before, if we want to limit the impact, if we want to limit the temperature, then the mechanism we have at our hand is to reach net zero as soon as possible.
We know, though, whatever happens, that we are going to have to deal with this extreme weather events. We're going to have to be dealing with situations we haven't necessarily faced before. Maria, how do you see the picture changing already from MSF in terms of extremes, droughts, heavy rain, etc.? What kinds of things are you seeing from the ground? What are your thoughts on that at the moment?
Well, like I mentioned earlier, the emergencies are just skyrocketing. And as one of the medical humanitarian organizations on the ground, the link between health and humanitarian action is very critical. We generally are the ones who are left behind, especially with conflict. So it's really lovely and wonderful to have the humanitarian community here as well, because the joint voice can really be powerful, because we're already overwhelmed, right, today. And what we're trying to do, though, is trying to be smart. For heat, for example, we're really looking at what we need to understand from the communities themselves. So one of our pilots that we will look at in next year is looking at in Kenya, the Dagahale camp in for the Somalia refugees who've actually fled for years because of conflict, floods, and droughts, because they could not actually sustain themselves where they were. So this huge camp that's been there for the last 20 plus years or more is something we're going to look at how they're managing and coping on the ground, and what kind of preparatory work we need to set up to support our staff, to support the patients, adapt for emergency preparedness, but also the structures we're using. Because heat, if you have good, cool ventilation, if you are able to put water points and ensure there's water, because there's also water insecurity that's related to heat, floods, and droughts, and health awareness and education is really critical. But like we said, there's nothing more equalizing than climate change. And that health information needs to be passed all the way around. And hopefully, by keeping health at the center of our discussions here, that will go all across the globe.
But, Marina, have you seen the landscape change? I mean, you just talked about the fact you were side events and now you're centre stage, but outside the kind of COP world, is the landscape changing? Also in national governments, I imagine that you speak to those as well, in regional governments as well. Do you see a change in the conversation related to climate change and health?
Yeah, absolutely. There's much more awareness now of the health dimensions of climate change all across the scope. The work that is being done here at COPs by the health community, not only ourselves, but mainly the WHO in championing that cause has been a fundamental driver. And COP is just a reflection of the fact that countries are engaging. If countries were not engaging in that intersection,
are they engaging and
here.
then saying, right, okay, we need a plan, we need to take action, we need to start adapting?
Yeah, there's a lot of progress being done in terms of adaptation. We, for example, the WHO and the WMO now have a joint office that look at that intersection and that promotes sharing of data and capacity building at a country level in terms of early warning, early response, early alert systems that are informed by climate data. So there is progress being done, and having had the first ministerial meeting here is fundamental, not only for COP, but because now countries understand that there's a place for the ministers of health within the climate conversation, and that they have an important role to play in driving climate action and protecting people from climate change. So that has been an enormous push, and we're hoping that we will see a lot more engagement between the different ministries.
Carlo, I've been following for years now how Copernicus Climate Change Service is touching on different sectors. You know, you a couple of years ago, you broke into the renewable energy sector, and suddenly everybody was very interested in what you were able to say about wind, etc., or about solar, all those sorts of things. People are engaging with your information. Are you having the same thing happening also with health engagement from leaders who want to take action and adapt?
Absolutely. Also because we are seeing the other side. So before we were talking about early warning. So that is the acute phase. You have something happening on the ground and you want to prepare the response as fast and best you can. But alongside that, there is a preparation, and preparation links directly to adaptation. So in a sense, there are things you can do now, and these things can be done at the local level, at the regional level, not necessarily only at the national level. There are things you can do now that reduce the vulnerability, that reduce the risk going forward. And I'm thinking about the way in which the cities are planned, are expanded, are improved and changed. And that connection is incredibly important. It's a connection that happens through local decision maker, but it's also a connection that can happen, for instance, with the financing of adaptation action.
Right. Yeah.
So how do we fund mechanisms that promote adaptation at the local level in a way that is sustainable, in a way that takes into consideration not just what is happening now or the risk we are facing now, but the risk that our cities and their citizens will face in 10, 20 years' time. And if you plan green areas, if you plan changes in the structure of buildings, or going back to what Marina was saying about the vulnerability of the UK. The school year or timing of grocery stores, right? If you were saying you are no longer cycling during the heat of
when it's the hottest times now, I don't go out.
Well, most of the places in Northern Europe, in most of the places, the shops shut at 5 in the afternoon. And if you're moving into a world that is much warmer, well, you may want to change that, right?
Behaving a bit more Spanish time style in terms of the hours.
For instance, but what I'm saying is that there are actions, and there are some simple actions, they are not expensive, that can be implemented and can have a profound impact on the vulnerability of people.
Don't you think that would, though, I mean, an example like that, imagine going to some shopkeepers in a regional town in the UK and saying maybe in the summertime you ought to change your opening hours because it can get very, very hot. They're going to look at you like you come from Mars, aren't they?
Sure, but that's for me is part of a bigger shift, and it's all about the way in which we deal with the environment and the risk. We have always dealt with those looking back and assuming the history, our tradition, were a good proxy, a good safe way of addressing the risk, and it's no longer. When we say is unprecedented, and we really mean it. We haven't seen it, not just as a human being or as a group of scientists, we haven't seen it as a civilization. So an example that emerged quite clearly at the workshop on cities and adaptation last week in Florence was the fact that cities, as a concept, have never seen temperature of this size.
Right.
So the way in which a city works is not designed to cope with this kind of temperature. We have to rethinking. It's an uncharted territory. Shifting the opening times of shops, I think, is a small things in that bigger shift.
It is, no, but it's something you put out there, which I think sounds like a surprise. It would get people talking for sure. But yeah, we're talking about adaptation to these health challenges that we have. Marina, what can you recommend? Are there simple things, in fact, that organizations or individuals can start to take in order to better adapt?
Look, there's a lot of behavioral change that is really helpful in case of extreme heat exposure. You have things as simple as putting blinds down in your home if you have windows that face to where the sun is. You have things that are simple as hydration, wearing lighter clothes. These are all things we've heard of, but surprisingly, they're not done enough. There's other interventions that are a bit less heard of, but very effective, like putting your hands, only your hands and wrists, in cold water is much more effective than a hot shower because of how our physiology works. And there's a lot of advice that is being given very regularly. But going back to the topic of closing shops, there's a point when you just don't feel like going out in the middle of the sun. In a hot day.
Yeah, a couple of years ago I did a story about heat and health in Rome. We went vox popping in the afternoon, and there was a couple of people walking their dogs in the shade in the park on one of the lovely hills with a beautiful view over Rome. And she was saying, well, I can't go out in the afternoon. We used to be able to go out shopping and it was lovely and we could sit and have a coffee, and now I just come to the park where there's a bit of air. Yeah. And that's what she'd done to adapt. In fact, she'd stopped doing what she used to do.
And in the UK, I bet as temperatures go up, the UK is really highly intolerant to heat because we're very ill-adapted to it. So if you don't close your shops, there will come a point when there's no one walking in the door. So you're going to be actually wasting a lot of money rather than opening when people actually feel like going out. That might be in the cooler nights.
Yeah. Maria, adaptation, where are we? Are we sort of thinking about the problem properly? Because I always think adaptation doesn't need to come down to, it does need to come down to very simple things like you're talking about, simple measures that you take. But how, from an MSF point of view, how do you see adaptation?
Well, I think this is very interesting about the opening hours. And we see already our staff, we were like, why are you being so lazy? Why are you not moving? Because they're taking a rest. And then you just start to think, oh, maybe it's a coping mechanism, in fact. That they are actually taking a time away to just cool off, to be able to continue to work.
Right.
So actually we're looking at how do we look at adapting our programs as far as the hours, and how to make sure that we mitigate it also for them.
And everywhere, all around the world.
Yeah, well, we're starting to see if that's possible.
Right.
Well, obviously in the colder areas, that's not necessary.
No,
so
but
it depends. But
in lots of places you're doing that.
Yeah, we're looking at this now. The other is obviously, as I mentioned, the structures themselves, because we cannot keep using plastic sheeting in camp situations.
Right.
That is just not. It's like a boiling.
Because it just creates a huge sort of bake, like a very, very hot tent.
So innovation, exactly, on how you keep the airflow moving, etc. But they're simple. And then fans. I was just given a fan yesterday, and now I carry it with me everywhere. But little things like that. But and you also see from local communities, they will take a towel, wet it, and put it around their neck. And you're like, oh, I didn't even think about that.
But you're interesting, your example about the emergency tents, because that's kind of something we would associate with you. If I said MSFs and somebody might imagine that kind of structure. So what is your future climate-friendly structure look like for emergency situations like that? Do you have a kind of solution?
Well, it needs to be that breathable materials that are sturdy, obviously, that you can build as structures. One of the things we're working with, and I know we have with IKEA, for example, that they've been working with UNHCR on building structures that are much more eco-friendly, one thing, obviously to mitigate your own kind of footprint, but also something that is much more adapted to the field settings that we're going to see in the future. One of the things we're going to do next year is to do climate scenarios, to really try to imagine what is a 2-degree emergency look like, what does a 4-degree look like, what is compounded on top of each other. So you're looking not so much hindsight for insight, but you're looking at foresight to really see what's ahead.
What are you seeing when you look in your crystal ball for that?
Very scary.
Yeah.
We need to think differently how we do water engineering. How do we're going to get water from the ground, because that even the surface water is decreasing. So we need to be much more creative. It's hard to imagine, and we need to force ourselves into it to really think outside the box.
Probably read Carlo's book. Carlo?
No, because I was going to react to this scary future, because is honestly a huge challenge what we have in front of us. But there is an anchor of hope to some extent, and it's the fact that this future is not unknown. We do have information, so we are not blind in front of some of the changes that are coming in. And so for me, a lot of the action needs to happen really in ensuring that the insight, the information, the knowledge, the data we have can actually find their way to inform decisions. Because the future will be different. It will be very different from anything we have seen. And we should be able to improve our ability to use the knowledge that exists, and is plenty.
You're absolutely right. And engaging with information and data is something that we're doing with our show with Climate Now on Euronews all of the time, and trying to get the facts of climate change across. It is difficult, but you have to just kind of keep repeating the information and saying this is giving context, giving information, and talking about adaptation, because people really want to talk about adaptation. They want to say, what should I do? How should I cope with this?
Sure.
And I, in my work, have to sometimes go and stand around in the sun, and I end up getting a little bit hot, let's be honest, and I don't really like it, and I'll come home exhausted, but it's light compared to the work that some people are doing outside in the heat. And I wanted to talk about working in the heat. What are the adaptation strategies that people can have for that? Because some people, that is their job, is they've got to be out there. They might be taking scientific measurements, they might be working on a roof, but they're in a very hot situation and they've got to get the job done. What can they do? Who would like to give me some ideas on that?
Well, look, to put it into context, you were just talking about people needing to take breaks, Maria, in the heat. We know that heat exposure puts outdoor workers particularly at risk, and that it also reduces their productivity. People need to take more breaks. It's very hard to work in the sun, particularly for physical labor. We estimate that since the 90s, the hours of potential labor lost increased by 42% due to heat exposure, and that has come with $863 billion lost in 2022 alone from loss of income. So it's having an enormous effect on workers. There are some workers that will be able to adapt better than others. If you work indoors, you have ways of cooling, both energy intensive and more sustainable ways of cooling. If you work in a shop, you could change your working hours.
Right.
You could change the way, kind of when you go out, if you do outdoor work. There's a lot of adaptation that we can do around that. You could take more breaks, hydrate, ensure that workers have personal protective equipment, that have access to coolers, to cold water, to permanent hydration.
And how do you make that happen, though? Because there are a lot of, I've got a pretty nice boss, but there are a lot of mean bosses out there that will say, no, you need to get the job done, you sort it out.
You have to regulate it. You have to enforce it, because that is the same way as we do any sort of safety in the workplace.
You put rules
it has
down.
to be a fundamental driver of our new regulations for the workplace. It is a hazard for workers. But the concern here is that there's some workers that have very limited opportunity or capacity to adapt. And that includes construction sector workers. If you need to build outside, either you don't build throughout the day or you just don't build. And agricultural workers. If you're an agricultural worker, you need daylight and you need to work in the day. And the problem there is that agricultural workers are also oftentimes the ones that supply the food that we need,
right,
and that our food security depends on.
So you need a change in law, basically, to help them.
You need a change in law, and you need to, above everything, address those communities, help them with behavioral change, and make everything that you have available to enable them to have access to shading, to have access to cooling, to have access to cold water, and to have a permissive environment for them to cool down and to protect their health above everything else.
Are there good examples where that is actually happening?
There are some examples of regulation, but everything is very context dependent. So I was just speaking with someone here at the UAE. They were telling me here is not allowed to work outdoors during peak hours of heat in the summer. That is an adaptation measure.
Yes.
if you work outdoors, you just cannot do it, and there's a regulation around that.
Yeah.
So there's many examples, but they will all be very context dependent. It will be dependent on the sector, and what we need to ensure is that every worker is protected and that there's regulation that is climate and future-proofed to protect workers.
That's the thing, yeah, exactly, that you take your kind of work and you understand what 2040 and 2050 look like. I want to finish up with something that, alongside health washing, I learnt about recently, which is kind of the co-benefits of being climate friendly and also health friendly. The example being, if you ride your bike and get on the train, then you've done a little bit of sport as well as not emitting any CO2 into the atmosphere. Is that a kind of positive health story that we can start to tell, Carlo?
Well, I mean, this is an example of co-benefit, which is quite nice, right? You reduce
well, it's fun.
Well, it's fun. It makes you fit and reduce the carbon emission. I guess in general is complex to find this co-benefit. And for me, one of the challenge in the nexus adaptation mitigation is really to engage with the complexity. So if you look at, for instance, afforestation, that is a typical way of mitigating climate change. Well, this has implication in terms of water resources, and implication in terms of forest fire risk. As a colleague of mine from the Netherlands was saying, it's not a matter of not having forest fire, it's a matter of how would you like your forest fire to be? And I think that's a change in mentality, it's a change and an engagement with the level of complexity that we necessarily haven't fully engaged with before.
But people have also talked to me about, changes in consumption patterns. For example, the kind of food that you're eating will have some kind of benefits as well for you. Like, you'll be healthier if you're eating healthier food, and that will also be better for the environment. Do you think there are kind of stories we can build around that could actually engage with people? Because they really do care about what they eat, let's be honest. What do you think, Marina?
Absolutely. Look, the health co-benefits are one of the main drivers, because the advantage that they have is that, as we always say, many of the interventions we need to be delivering to tackle climate change are, in essence, very sensible public health interventions. So when we talk about cleaner air, you can have stringent air quality regulations, and that would come hand in hand with reduction of fossil fuel burning in urban centers, would mitigate climate change and could avoid, as we said, like from 1.2 to 5 million deaths every year. You have healthier diets. Transitioning the agricultural sector, our food systems contribute to about 1/3 of all global greenhouse gas emissions. But we know that transitioning to more plant-rich, healthier diets and reduction of excessive consumption of red meats, ultra-processed meats, dairy products could save, we estimate, something around like 9 million deaths every year. And that would be something that would be enormously beneficial. As health professionals, we're always insisting healthy diets is healthy body. And that could be just thought of as a very sensible public health intervention with an enormous impact on our food systems and our sustainability.
But it's an interesting way of framing it too, because I know when I've covered health in the past, they talk a lot about preventive health. And this could actually be part of that narrative as well.
Absolutely.
In fact. But how do you engage with different populations, Maria? Maybe you've got some experience on that.
Look, it's very interesting, because I've always, as a medical humanitarian worker, it's always about vulnerability and responsibility. And that's actually how I see climate change. We all have a responsibility, whether as an institution or an individual or a state. As a human species itself, we have a responsibility to each other. And we address to the most vulnerable, especially the ones that are affected today. And I just wanted to react to the previous questions about the adaptation, because we also see it's a duty of care, in fact. So with the health framing, it's you understand what it is to stay healthy, what is important for well-being, and that in itself engenders responsible action. So hopefully
do you think that medical professionals, from everything from family doctors to people who are working in hospitals, are engaged with this as well? I mean, we've seen some of them demonstrating here, but as a whole, are they?
So there's a lot of work of also getting the biggest voice on health community together. And a lot of the things we're doing is on education, and another kind of collaboration we're doing with different academics and really just bringing in, we need to bring it to our educational system, especially medical education, but not only, it needs to be everybody, because this is an interconnected issue and multi-sectoral issue. So
It is.
while medics have a voice, we should use. It should be everybody's responsibility, in fact.
And everybody is concerned, as I said. And I'm going to wrap things up there. Thank you. It's been absolutely fascinating talking to you about this. And I hope people watching have been able to kind of get some of the complexity, as Carlo was talking about, of this problem, but also some of the positives that we talked about there at the end, about some of the way that you can change your behavior and possibly have a good impact on your health, as well as on the environment. Carlo Buontempo from the Copernicus Climate Change Service, Marina Romanello from the Lancet Countdown, and Maria Guevara from Médecins Sans Frontières. Thanks very much for being with us here on Euronews. Thanks for watching, and please keep following Euronews.com for all the latest news here from COP28, and of course all the other news around the world. Nice to see you. See you soon. Good. We're off. Thank you. Well done, everybody.
Thank you so much.
Oh my gosh.
That was cool.